Hello, everybody. This is Irina Strunina and Kim Kyle, and we are starting our next third session, Diabetes 101 for Caregivers Crash Course. This is the 2 hours session where we are trying to provide as much information for people who are taking care of those who were diagnosed with type 2 diabetes. Maybe you are their partner, maybe you are their real caregiver, maybe you're their child or spouse, in whatever capacity you are. I know that the challenge for caregivers is that as a caregiver myself, we are always not fully informed about diagnosis, about the course of action, what to look for, what the signs that things are going well, and what the signs that we need to pay attention to because things are not going so well. So I thought that this is very important. Why? Because I've been a caregiver. I did take care for my husband who was diagnosed with type 2 diabetes for different reasons, not necessarily being a bad person with diabetes, but he had eventually ended up with the complications. He had kidney failure and he passed away after 13 years from his diagnosis. And the last 2 years were really not good. He was on dialysis. We did home dialysis, and he had been always in horrible pain, and his eyes were not working as well, and he just did not enjoy his life. So I did not know much about diabetes until that started. Until that, he was managing the diagnosis by himself, did not want to get much help from me. He thought that he can manage it himself. So as much as I tried to offer help, it was not accepted as much as I would like it to be accepted. And I was really living in a house with somebody who kept a lot of his suffering to himself. And this is the challenge that a lot of caregivers are facing. He would be going to doctor's office. He would be talking to doctor. He would be given suggestions, recommendations. He would be given the numbers of his latest blood work. And he would not share it with me because he's a strong man. He can manage it. And plus, the next thing that I later learned from him when he was frustrated with something, that he did not believe that I can understand him because he was the one who was suffering those pains and challenges, and I was just next to him. So even we had very good relationships. We had a lot of trust in many, like almost every point in our lives, except for this one. Somehow I did not earn that trust. So I don't expect everybody to have full relation, 100% understanding in your relationships with person you're caring for. But I know that it's very important to know what to expect, what is happening, and where you can help. Very often, the help could be just to listen, to offer an ear, and people could just express their frustration, maybe share some of their feelings. Um, Maybe you can offer that help after listening to our courses. So I invited Kim because she is also a caregiver, professional caregiver. She's been caring for her father for 30 years. She is caring right now for people with diabetes. She will tell about herself more. But I am doing this from my standpoint. And I'm happy that I have help and support. And I hope that you, listening to us, participating in our events, sharing this information with other caregivers, you will help yourself and them. And I will stop on this one. I have a lot of stories to share. Maybe in different sessions, I will share more. And Kim, please tell about yourself because this is important for people to know who you are.
Thank you, Irina. Again, I'm so happy to be in your world. You have created this amazing group of people who are just seeking advice, help me out. And it's really the caregivers who are often left in the dark about how is their family member being treated? What are the medications for? What are we supposed to do with all of that information? And honestly, even the people with diabetes don't really know how their medications work. So thank you for letting me present this today because I will tell you, as a caregiver myself, and even though I was going back to college to be a dietitian after my dad was diagnosed with diabetes, I still, even today, I need it very simple. Tell me in the most easiest terms, and that's how I explain it to my patients. And it doesn't matter your education level, because I'm telling you, when I can break it down very easily and give visuals why these medications work, it clicks.
Mhm.
So you're going to hear from me, not professional language. I'm going to be speaking like a normal person. Okay.
That's
But
that's the
yeah,
key.
that
That's
is the
the
key.
key. Unfortunately, and I will tell like in a minute, unfortunately, very often when we go to doctor's office, doctor living in this world,
Yeah.
they sometimes miss that line where their professional education merges the life and they start speaking the language that is not completely scientific, but is very specific. And people who were not immersed in this world, they don't understand. So, Kim, this is why your participation is so valuable. You are a professional, but you can say it in a way that people understand and can relate to.
Well, thank you very much for your confidence. And just again, my history is I took care of my dad. Well, I actually had to go to school for about 8 years. But aside from that, once I did become a dietitian, I was praying for a job in diabetes, which I got almost immediately. So I have been in the diabetes center where I work right now for the last 19 years. And every day is a happy day for me because I get to talk to people like you and help everybody out. But I have a presentation on the medications, and I even learned a few extra things as I was going through the research and doing this. So let me share it with you now. And if you have questions or comments, but please also share this. If you think your partner, the person you're caregiving for, a family member, a friend can benefit from this information, please share it. I'm sure Alina will prepare everybody with the links.
Absolutely. Kim, before we go, I would like to actually give a quick overview of what to expect today because
Okay.
we have 2 hours, and for someone who may be joining us at this moment, um, uh, they need to know what to expect. So this is our first slide. This is us. Um, we already said words that are introduction. I would like Kim to go over this essential facts about diabetes. Unfortunately, as I said, um, medical community, medical professionals think that we know it, but we I did not know. When my husband was diagnosed, I had very, very vague understanding what diabetes is. Um, Please go over the nutritional part. Those 3 minutes, please talk about the importance of nutrition when we are talking about food. Since you are really a registered dietitian, you can, I know we already had presentation by you about the nutrition and about A1C, right? That's what we were talking about. We have the recordings. And then please move on to, and you could stop and ask the questions and we could discuss a little bit what you say. Uh, and then you will do your presentation on medications, on the pharmaceutical part, because this is the important part to be aware of. And very often, again, we are shooting in the dark. We don't know what we don't know. And I hear so often that people are eating something that they're not supposed to be eating. And then, oh, okay, I just took extra metformin and went for a walk. Well, went for a walk is a great idea. Took an extra metformin. I'm not sure this is the right thing because metformin is not working like this. It's not the insulin shot. So this is something that I wanted to let people know. We will talk about a little bit about emotional aspects because this is very important to know where we are. And we'll have the whole list how and where we can support you. And if there will be questions, we'll go over that. And that's the plan for today. So Kim, as I said, please, details, very important knowledge pieces. What is diabetes and what we need to know about it? Because this is something that when people are getting this, like you've got diabetes, like a lot of people in our Facebook group, they go to the doctor's office, they run the blood work, they get this phone call, you've got diabetes, your medication is in the pharmacy, let's schedule a meeting in the next 3 months. Uh, what to do? Diabetes, what does it mean that I will die soon? Does it mean that I will go blind? Does it mean that I will lose my leg? All these very scary thoughts are running through people's heads. So we would like the first and foremost, I was extremely scared. I was horrified when I learned that my husband was diagnosed with diabetes. I didn't know what to expect. Uh, the information, what is diabetes, is very important to know for the peace of mind. So if you please talk about it a little bit.
Yes, I will. I absolutely will. I have those slides from another presentation, but I'll just talk.
Mm-hmm.
So when my dad was diagnosed with diabetes, he saw a picture of his mother, my grandmother. My grandmother was a double amputee because of diabetes, and she was blind towards the end of her life. And so when my dad was diagnosed with diabetes, he thought he's going to lose his legs. That's the first thought he had. And that's not true, but I imagine that probably really scared him. So, I mean, I don't think this is a weird way to look at diabetes, but it's almost a gift of your body telling you there's something wrong, something is not working right. And guess what? You have a lot of power to do something about it. Many chronic diseases, we can't do anything about it. We have cancer, we need to go to radiation therapy, and we have to do all these things. But diabetes is something that you can control, which for me is a gift. When I have patients in my office, I'm like, yeah, we can think about it. This is really, really bad, but let's think of all the things that you can do to actually improve your blood sugars. And a lot of it is things that you might not want to do, like eat differently and exercise and keep your doctor's appointments. And maybe you do need medications, but all of that can help you reverse diabetes or control it. That's really the bottom line, is to control it. Now, when you go to the doctors and get your A1C, they're going to let you know, oh, you're going into the pre-diabetes range, or oh, wow, you're finally in the diabetes range. So what that A1C is, it's a 3-month buildup of sugar on your red blood cell. As the blood cells collect sugar, they grow very big. And in 3 months, they're so big that your blood cells burst and they're reabsorbed into the body. So what we're capturing is that 3-month-old blood cell, and we're measuring how much sugar is on the outside of that blood sugar, on that blood cell, and we measure that in a percent. So you can imagine, it's like, wearing one backpack, two backpacks, three backpacks, 10 backpacks. You can imagine, you're going to be able to see the difference of how much sugar has collected on that red blood cell. And that's what we measure. So an A1C of 5.7% to 6.4% is prediabetes. But once you cross that line and get to 6.5% and higher, you have type 2 diabetes. Can you improve it? Absolutely. There's so many things that we can do about that. But it is very emotional. And I hear a lot of pushback, like, I just, I'm just going to try to do something on my own. And, I see anybody with an A1C of 6.5 to 16.5. 16.5, I'm telling you, those patients, I would not recommend just trying to do this on your own. I mean, you definitely need medication intervention, something to get those blood sugars down quickly. Because here is the worst part. Here's what you need to know. Why does diabetes affect our eyes? Why does diabetes affect our kidneys? Why does diabetes affect our feet
Heart.
and our nerves and our heart? It's because sugar in your blood is not meant to stay there very long. So really, the basic definition of diabetes is a high blood sugar longer. Sugar is supposed to be whisked away very quickly out of your blood with the help of your natural insulin cells. If sugar is in the blood too long, I almost explain it as it's sandpaper inside your arteries, which is making your arteries very thin and very wiggly. And so you're more prone to clogs, and it's almost like you have a piece of thread coming out of your shirt, kind of everything collects on that. That's what's happening on the inside. So keeping those blood sugars normal is going to prevent damage. So we have little tiny vessels in our eyes that can get loaded with sugar and they can burst or they don't work as well. Same thing in our heart, same thing in our kidneys. So these are the first organs to be impacted by high blood sugars. So getting the blood sugars in a normal range as quick as possible is absolutely the best treatment. It's an emotional journey. You want to do it on your own, but sometimes you do need the help of medications. So I just want to normalize that for everybody and to understand that, yes, if you want to get off the medications, absolutely, I'll help you. There's many dietitians out there that will help you, but you have to be willing to do some hard work and some changes. But the fact that you can do that, you have some control is amazing.
It's empowering. That's right.
Is there anything, Arena, that you wanted me to cover that I hadn't covered yet?
No, this is good. This is important for people to know, to understand that this is a diagnosis, but this is not the life sentence. And it's like for every prisoner, you could get out of there fast if you follow the rules. And if you are rebellious and don't want to follow the rules, you are risking to stay there longer than you initially was assigned. So not a life sentence, everything in your hands most of the times. I wouldn't say absolutely everything, but there is a team that is here to help you. And caregivers are included in a team, doctors are included in a team, dietitians are included in a team. Maybe you have a membership in the health club, the personal trainer is included in the team. Maybe you have a friend who is walking because they had a heart condition and they need to walk. They're your team, they're your accountability partners for doing some physical activity. So it's a team sport, and this information is very, I think, important to be aware of and use as much of it as it possible. One more touch, please, Kim, about the nutritional part. What is important there to know?
Thank you very much. I do have some information on the nutrition part after the medications, but just to give you just a heads up on nutrition, food is medicine.
Mm-hmm.
Can you heal your body with food? Yes, you can. I'm going to show you how to do that. There's a lot of information out there. I really get a lot of my information from the American Diabetes Association, from this group. There are a lot of other professional organizations out there for diabetes that you can, Google search, but American Diabetes Association is the place I like to start. They just have some basic information. Plus, they have an amazing website of recipes, meal plans, carb counting. So, yes, there are certain foods that raise blood sugars. Those are not evil. They're not toxic. You're not going to die if you have carbohydrates. Carbohydrates is the group, though, that we manage the most strict. Yes, we can have a lot of variety of carbohydrates, but surrounding those foods with other foods that delay the digestion is a beautiful strategy where you can eat foods that you love, your traditional foods, but doing it in a strategic way improves blood sugar. So yes, food can be used as medicine, and I'm going to share that with you once I get through the medications.
Perfect. Oh, thank you for that. And let's move on because I'm sure the information you have to share is pretty rich, and we need time for it.
So I'm a dietitian for the last 19 years and a certified diabetes educator for the last 19 years. So it is my pleasure to serve you guys today and to give you a presentation that's very easy to understand. This is how my brain works, and I hope your brain works this way too. So I love visuals, and this is the visual I usually get when I see somebody for the first time. My doctor wants me to take this metformin or this shot or this, but I don't want to do it. I think I can do this on my own. And you know what? Sometimes you can. And often the doctor will say, I give you 3 months to try it on your own. But the bottom line is, if you are not on top of this, if you are not understanding where are your blood sugars right now by checking them or getting one of those CGMs to know how are your blood sugars being affected by your meals, doing it on your own is not going to work. So you have to really be involved in this is where the caregivers come in as well. The caregivers knowing that this is like Irina said, this is a group project. Everybody is involved in your care. If you live in a home where you have a spouse and children or friends or girlfriends or whoever, everybody's got to be in on this because it really is a group effort. And you need the support. The caregivers need to know almost as much as you do. Now, some don't. I often will just see the husband or just the wife, and maybe they don't communicate. But if you have somebody in your life with diabetes or you have diabetes, reach out. I bet you there is somebody in your family that was just waiting for you to ask.
Mhm. Oh, to team up together because I needed to do it already for so long. Now, when you also have it, we could do it together. Uh, Something like that also may happen, and this gives relief for two people right away. The one who was just diagnosed and the one who been already diagnosed for some time, and they kind of like they feel, okay, I'm not the only one. There are other people. And that's actually what is good in our Facebook group, Diabetes 101 for Beginners, where we have right now at this moment 167,000 people join the group. Not all of them people who have diabetes. There is a lot of caregivers there too. So everybody are joining together to see what is going on, learning together, sharing the information, and that's what um, this is, and Kim is the professional who can provide professional opinion on that from the experience, personal experience, but also from the information that you have to search and understand. And she's here to, she already made the search and she could help you to understand it. So let's move on.
The most interesting thing about diabetes is you could be on 5 different diabetes medications. And each of those medications is working differently to improve your blood sugars. Again, there's always pushback. Oh, my doctor wants me to add another medication. I'm already on this metformin. I don't want to do this. Like, it's going to help in another area of your body. You can absolutely be on multiple diabetes medications to get the best result. Now, eventually, being motivated to get off the medications, that's where the natural strategies come in, which is diet and exercise and weight loss and all of the meal planning strategies and things like that. But you can get off some medications, absolutely. But they are here. This is the big thing. I would rather you start the medications now. Let's get those blood sugars down. Let's stop the damage today and then work on getting off the medications. That I say that to every patient. It's better to do it now, and then I'll help you to get off them. Sometimes they're like, okay, I get that. And sometimes they're very adamant about, no, not going to start it. So, and that's fine too. It's your personal decision, but the quicker that you can get those blood sugars improving so they're not causing damage in your arteries, to your eyes, your kidneys, and your heart and your nerves, that damage cannot be reversed. Once the damage is there, it's there. So for that reason, I'm a big fan of having multiple medications for some of my diabetes patients. So we have medications that work in the liver. We have medications that work in the pancreas, which is where insulin cells live. We have medications that help the kidney release sugar. Isn't that cool? And, this whole new trend of medications that impact our stomach, our gut, makes us feel fuller longer. We're going to cover all of those. So visually, I call metformin the plumber of the liver. Now, what do plumbers do? They fix leaky pipes. And you might not know this, but your liver makes and stores blood sugar. In my world of diabetes, sugar is not a bad word. It's actually our preferred energy from our head to our toe. Our body runs on blood sugar. That is our fuel. Now, yes, there could be too much, and that causes the higher blood sugars. But metformin is a really neat medication. There's a lot of controversy, but listen, I think it's all hyperbole because metformin has been around for the last 5 decades. I mean, my dad was on this in his very early journey with diabetes. This was his first medication, and he continued this medication throughout the rest of his life, even though he had other medications added. But metformin is been around for very long. It's generic, it's cheap, and we know it works because here's what happens. Your liver can be leaking sugar all day long. It's not supposed to do that. But in my patients with diabetes and in my personal family history, this is what we see. We see our liver just leaking sugar all day long when it doesn't need to be. And usually this happens at night. So the first thing that we can do is improve the blood sugars at night. Metformin is a medication that you would take with a meal, primarily because metformin can cause a little stomach discomfort initially. But adding metformin is just literally tightening up the leaky liver from depositing too much sugar during the day. We really don't need that liver to work all day long when we're eating. Maybe at night we need some sugar if we're not eating from the liver. The liver can make it and deposit it into our blood. But if we can tighten up those leaky faucets, then that is exactly what the body needs. So that really explains what metformin is. It reduces the blood sugar that comes from the liver. This medication is safe. We have children on this medication because it doesn't cause low blood sugars, which is hypoglycemia. It doesn't cause that at all. So it's a very safe medication to be on. We don't see weight gain with this medication. Actually, we probably see weight loss a little bit. It's cheap, and you can be on multiple doses of metformin, up to 2,500 milligrams. There's no more improvement over that amount. Each pill can be 500 to 1,000 milligrams in size, but very affordable, very convenient, easily found at all pharmacies. But there are some side effects. There is to any medication, there are disadvantages. The biggest disadvantage is the stomach issues, bloating, gas, diarrhea, nausea, and that could account for some of the weight loss. But from the patients who have been on this medication over and over again, I ask them, how are you feeling? And 9 times out of 10, here is what I am hearing back from them. Well, it was a little rough the first few days of taking this medication. But after I was on it for a week, I didn't have any more symptoms. And that's usually what happens 9 times out of 10 to most of my patients. Your body gets used to it. The nausea stops, the diarrhea stops, and you're taking it. Your blood sugars are much improved. I've seen patients with blood sugars of 300 initially at initial diagnosis, just take 1 or 2 metformin a day and completely recover their blood sugars. So it depends on the person. I don't know why it works well in some and it doesn't in others, but it's the first line treatment. Like your doctor has a list of medications, and this is the part I hate. The insurance is not gonna, have the doctor just go straight to the GLP-1 medications or the other medications that are very popular. You almost have to try them all before you can go to the next level. Some doctors, I think, can override that, but this is what I see mostly. So metformin is very safe. It lowers the blood sugar. It has a 1 to 2% impact on your A1C. But another side note, it can cause a B12 deficiency. B12 is absorbed in your stomach. So it could be a good idea if you start metformin to consider a multivitamin in addition to a B complex or even just a B12 supplement. And some of my patients are getting B12 shots, injections. For whatever reason, you're not absorbing B12. It's a very important vitamin to help you with oxygen and a lot of other B vitamins for energy. So it is something that you definitely want to be aware of and be checked for if you find that you're low in energy. Could be B12. Yes, Irina.
There are two things that I want to say that I've heard that okay, there will be a question from Tanika. She joined us just now. And what is leaky liver? The one thing is it's recommended by doctors, and I've heard that when people follow this direction really closely, they have less problems with metformin. Is don't take it on empty stomach. Have it with the food, not before the food. And the other thing that I hear and see a lot people commenting in a group that they're saying that metformin caused them the kidney disease. What can you add to these points? And of course, the leaky liver one more time.
That's a really interesting, yes, I do hear that a lot, but it's high blood sugars that cause the kidney disease, not metformin. So
Hmm.
sometimes these patients have had high blood sugars for a long time. They get on metformin, they're diagnosed with kidney disease, and they almost correlate it's the metformin that caused it. It's not. It's the high
Hmm.
blood sugars.
Hmm. Hmm.
So,
What a,
Tanika, yeah,
yeah.
thank you for joining us. Yes, your liver does a lot of functions. It helps us to filter alcohol and it helps us filter a lot of things. But what the liver also does, which you may not know about it, it stores blood sugar and it can also make sugar. And sometimes in people with diabetes, the liver just, for no reason, decides to just leak a bunch of sugar into the system. So if we can reduce the output of sugar from the liver, that's going to lower your blood sugar. So if the liver is a little bit leaky, that is the main point with metformin. Metformin targets the liver, tightens up the leaky pipes, tells the liver, don't be, putting all this sugar out into the blood system, all day long. You don't need it. So it almost attacks that first. That is the first function of metformin. Metformin does have another function. It does help your insulin cells be more accepting, or stronger, a little bit, working a little bit faster and harder. It doesn't make more insulin. It just helps what you have become stronger so it can lower that blood sugar more quickly.
All right, thank you. We could move on.
Right. These are other medications that are very inexpensive, but they work very differently than metformin. I see a lot of people who are starting metformin and they really don't get the blood sugar lowering effects that the doctor wants. The doctor may add one of these medications to improve blood sugars a bit quicker because they are stimulants for the pancreas. The pancreas is where insulin lives. The pancreas has a lot of functions, but one of its function is to be the house for your insulin cells. Here's something you may not know about insulin. You are born with all of your insulin cells. For whatever reason, they are destroyed by your own body or they slowly stop working through your life. The insulin cells are still there, but you might notice your blood sugars are higher because the insulin cells are not working as fast as they used to. So what these medications do, glyburide, glipizide, and glimepiride, they tell your pancreas, hey, I know you're tired, but can you find more insulin cells and dump those into the bloodstream so we can get these blood sugars down? So that's really what these medications are designed to do. You're not going to be on two or three of these, you're going to be on one of them. They all work the same. So
In
sometimes,
addition to
Mhm.
metformin or instead of metformin?
In addition, because metformin targets the liver, so
Hmm.
it's not leaking as much sugar out. And then this medication you can also take at the same time because it's not targeting the liver, it's targeting the pancreas to help stimulate more insulin release from the pancreas. So, let's say it takes, three people to, I don't know, build a house. Well, those three people are going to get really tired really fast. So this medication stimulates more helpers to get that job done quickly. So if your blood sugar's high and you're on glyburide, glipizide, or glimepiride, your pancreas is getting the message. All right, let me just take anybody who's in here. We are going to all come out into the bloodstream and get those sugars out of the bloodstream and remove them to the cells that need the energy in the first place. Your blood is not meant to store sugar. Your cells store sugar. So we got to get your sugar out of the blood and to the cells as quick as possible. The longer the sugar stays in the blood, the more damage that can occur to your arteries, your vessels, the small ones in your eyes, your heart, your kidneys, your nerves. So the quicker we can get that sugar out, the better. And oftentimes this works very fast. Metformin may take a few weeks to really get to its strongest strength where it can really be impacting your blood sugars, but the glyburide, glipizide, or glimepiride works very, very quickly.
So this is the before doctors will prescribe you the insulin shots, they'll prescribe that because that helps to activate those insulin that you already produce personally, your body produces before you add more from the outside, the extra insulin, right?
That's right. That's right. The insulin cells in your pancreas might just need a wake-up call. Maybe they
Mm-hmm.
need a loud alarm, hey, everybody, let's go. We got work to do. And that's what glyburide, glipizide, and glimepiride can do. So you would be on one of these, not all of them. It's one or the other. Really depends on what your insurance will cover. But these medications are very inexpensive at the pharmacy. They are generic. They've been out for a long time. So the cost on this is very low. And I remember my dad, we had other medication options for him, but he said, absolutely not. I'm not paying more than $5 for these medications. And, he would rant and rave about all the money he spends on the diabetes. So it's an affordable medication. And he was on this one as well through his entire journey with type 2 diabetes.
And I know I look at the notes you said there. Avoid if you have a sulfur allergy. My husband had sulfur allergy, so that's why I didn't really even know about this medication. We did not have this in our list.
That is correct. And sometimes the doctors don't know about your allergies. So if you will know, if you have a sulfa allergy, you will know that. And you need to always let your doctor know if you have any type of allergies because this is not recommended if you have a sulfa allergy.
Mm-hmm.
Now, here's what happens. My patients will get the diagnosis of diabetes. Their blood sugars are high. The doctor's throwing a lot of medications out there. We're going to get you on metformin. We're going to get you on glipizide. And then you change your diet. Like you start eating better. So these medications can lower your blood sugars to the point you can become hypoglycemic, which is a blood sugar under 70. So sometimes changing the diet might be all you need. You may not need to add the medications. So if you're changing your diet and you're on these medications and you're having low blood sugars, you don't have to eat more. You just reduce the medications or get off the medications. You can work with your doctor on how to do that safely.
Mm-hmm.
But I'm a big fan. If you don't need it, let's not start. But it is there to help you quickly get the blood sugars down, and it's not an injection.
Mm-hmm.
If you have liver or kidney issues, there are we're looking at the glomerular filtration rate of the kidneys. If you have kidney damage, maybe these are some medications that may not be appropriate for you any longer. And oftentimes that's when patients are switching over to insulin to get that same effect.
Mm-hmm.
The one drawback in my professional look at all of this, remember I said you're born with all the insulin cells that you're going to have for your entire life. We want to save those insulin cells for our entire life. But if we are stimulating the pancreas to keep, those lazy insulin cells that really are, they want to be retired, they don't really want to work hard, you're going to cause more of them to become inactive quicker. So this is the big drawback with this. Yes, it does improve the blood sugars very quickly, but that's where the natural part comes in, the diet and the exercise and, making some changes so you can get off these medications and naturally control your blood sugars. Now, my dad was never able to get off medications. He and his family, and I've inherited that a little bit. We are just very insulin resistant, where our insulin cells are there. They just don't really work as hard as they're supposed to. So this is what happens. You have to just use your doctor and really rely on your doctor to help you, but also to ask a lot of questions. And this knowledge that you're getting today might drum up some questions for your doctor, like, is this something that I really need? Can I, reduce they come in these little pills. This glipizide is very, very, very tiny, but you can even half the pill. There are situations where if you're having low blood sugars, sometimes people say, well, I just have to eat more. No, 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 don't eat more. Just let's see if we can reduce the medications. But that's usually something that you'll discover, and you can talk with me or your doctor about it, or your dietitian. Maybe you have a dietitian where you are. And I would recommend that. If you've never seen a dietitian, ask your doctor to refer you to a registered dietitian that specializes in diabetes.
Mm-hmm.
And if you are on this medication and you skip a meal, you can't take the medication out of your blood. Once this medication, you have taken it in the morning or you're taking it in the evening, you really are committed to having those 3 meals a day minimum.
So here's the question. Starting on this medication, does it make your body dependent on it, so you have to stay on it?
No, because if you do other things to help absorb sugar, which is exercise, muscle training, um, meal planning, sometimes that's all you need to make your body stronger to absorb the sugar. We're just trying to get the sugar out of the blood as quick as possible. If you aren't physically able to do that, then this medication is great until you are able to do that. And sometimes it takes years, a lot of my patients are losing weight. They're not able to exercise. They have bad knees. They have bad hips. They have a bad back. So sometimes this medication is going to help you until you are able to do that.
Mm-hmm.
It's not magic. I mean, if you have a poor diet, your blood sugars are still going to be high. I mean, it doesn't work perfectly, but in addition to meal planning strategy, the whole goal is to get those blood sugars down quickly to stop the damage. You can stop the damage. You can prevent the major complications that my grandmother suffered, which was double amputee. She was blind. And, this was 40, 50 years ago. And so we didn't have a lot of the knowledge that we have now. So less and less of people that I know in my practice are suffering those complications. But that's the point. We have to stop those complications. You can live a very long, wonderful, beautiful life with diabetes as long as you know how to control those blood sugars. The blood sugars, are not controlled. Um, I worry. I really worry about my patients not having a great rest of their life.
All right, let's move on.
So there is this, when this medication came out, I was fascinated. I thought, wow, another medication. You can be on metformin, you can be on glipizide, glimepiride, and you can also add a medication called an SGL2. And that's the fancy name for let's open the floodgates of the kidney and let's that sugar out into the toilet. Basically, your kidneys are designed to reabsorb sugar when you're urinating. But this medication's like, nope, let's not do that. Let's let all that sugar go into the toilet as you're urinating. It's fascinating. How can we actually do that? How can we tell the kidneys to do that? Well, these medications, Farxiga, Jardiance, Invokana, Stalactro, which I don't see as frequently, I don't know because of the cost, but the kidneys let the sugar out. They do not reabsorb it. So this is a great medication because it only works on the fluid that you're urinating out, your waste. It does not lower the blood sugars. And because you're letting a lot of sugar out into the toilet, you're also letting out a lot of calories. So guess what this medication also can do? Help you lose weight. It's just a brilliant medication. I was so fascinated when this first came out. And so that's what it does. It doesn't cause hypoglycemia. I mean, you're not going to have low blood sugars with this. So this is a really fantastic medication to maybe a metformin and a Jardiance, or metformin and a Farxiga, or the glimepiride and the Jardiance. So there's lots of ways that we can combine this medication because it's targeting an entirely different organ. So you can be on multiple layers of medication to get the impact that we need in lowering your blood sugars, to save your kidneys, to save your heart, to save your eyes, to save all the organs that you need to keep for the rest of your life.
So it's not that it's not one medication on top of another, but all geared up to work only with liver. Oh, right? It's omni effect, so working on helping out other organs as well to manage this condition.
Yeah, so many of my patients I'll see on 3 or 4 different diabetes medications, and they don't really understand how they all work together. And once I break it down for them, they're like, "Oh, okay, I get it now." The metformin's for the liver, so the liver's not so leaky of sugar. Then the glimepiride helps with my insulin cells that live in my pancreas. And then the Farxiga or Jardiance is targeting the kidney to allow the kidney to release more sugar into the toilet. And that's where it goes. And you flush it down and it's not reabsorbed into your body. However, there are some drawbacks. More importantly for women, ladies, when we are peeing out more sugar, and we have a very warm, moist area near where we urinate, our vaginal area. If we get sugar in our vaginal area, that could grow into a yeast infection or bacteria. Same thing for our urinary tract. We could get more frequent infections, a UTI, yeast infections. Men aren't usually targets of this, but some women are. So you have to be careful,
The
how
personal
you
hygiene.
recover
Yeah, with
after
the
going to the
personal
bathroom.
hygiene. Yeah.
Now, this does lower the A1C a little bit more, 1 to 2%, which is very good. And here's what we found out about this medication. It reduces fluid. So, off label, a lot of doctors were using this for heart patients who didn't even have diabetes, but just had a lot of fluid buildup around their heart called congestive heart failure. This medication worked to improve congestive heart failure. Also, kidneys, if you have kidney disease, maybe it's not from diabetes, but you also can have a buildup of fluid. This medication improved that. So, even if you didn't have diabetes, the doctors are discovering other conditions that could definitely benefit from this loss of fluid. So it is used now for congestive heart failure. It's one of the primary medications they use for that, and chronic kidney disease.
Okay, question. But it's not the same as the water pills, right?
It's not the same as a diuretic, no.
Okay. Just check.
They could be on a diuretic as well, but because heart patients sometimes have blood sugar issues and kidney patients have blood sugar issues, this takes care of both of those issues where the diuretic does not. Because the diuretic is just a loss of fluid, but you're still reabsorbing the extra sugars.
Okay.
So they primarily just use this one because it doesn't cause a low blood sugar. So it's really safe for many people to take, even if you don't have diabetes. So that's I mean, I have been in the diabetes center 19 years, and I was here when this first came out. I mean, it was just amazing that, my grandmother didn't have anything to take but insulin. That's it. That's all they had for, diabetes in the 70s and 60s and 70s. But now we have just expanded all the different tools that you can use to keep your blood sugars lower. And this one was also extremely fascinating. Januvia Tridenta, this was a pill that you could take. And here's another organ that can improve your blood sugars, your stomach. Isn't that brilliant? So we have the liver being covered by metformin. We have the pancreas being covered by glipizide and glimepiride. We have the kidneys being covered by Farxiga and Jardiance. Now we can actually have a medication that targets the stomach to improve your blood sugars. Again, a very low risk of hypoglycemia, which is a low blood sugar. But what happens is when you take this medication, it slowed down your digestion. The food is not going to be breaking down very quickly. It stops the enzymes that break down your food quickly. And so your food sits in your stomach longer. What's the result of that? You eat less. If you eat less, you have much lower blood sugars after eating. So it was really an interesting way to start this journey of, okay, if I just eat less, I can't do it naturally, but maybe this medication can actually help me to get fuller quicker so I have the ability to eat less. Because being hungry is very, very tough not to eat when you're hungry. This medication, because when we overeat, we're just used to eating a lot of food. And so this could help you on that journey to start to eat less. And so it really has worked tremendously well. It is not an injection. I'll talk about the injectables in just a moment, but it makes you feel fuller quicker. It slows the digestion. And the secondary impact is it does actually tell the pancreas, is the secondary impact, not the primary, to, move more insulin cells into the bloodstream to get that sugar out quickly. Disadvantages. Yeah, if you have a slow acting stomach, you could develop more nausea. If you eat very quickly, and again, that food is kind of stuck there and it's not moving out as quick as you normally would, you could have heartburn, you could have vomiting, flu-like symptoms. And joint pain. That's something that's very targeted with this medication. I don't understand why it causes joint pain, but it seems to be a very common symptom. So if you're very arthritic and you already have joint pain, this may not be the medication for you.
So, with diabetes, very often one of the kind of like accompanying diagnosis is the gastroparesis. So that's not the good medication for people who have already developed gastroparesis, right?
That is a great statement. Thank you for bringing that up. Yes, gastroparesis is a damage to the nerves in your stomach due to high blood sugars. So it's almost like an escalator that's broken. So if your stomach isn't moving anyway, this is the last medication that you want to take because it will just make that even worse. So your stomach is literally a conveyor belt or an escalator that keeps working. Your food goes in and it goes out. If that conveyor belt is stuck, that food just stops moving out of your stomach and you could be very sick. It causes a lot of complications. There are certain food textures you have to eat. I mean, I work with patients all the time with gastroparesis, and it is a really tough nutrition strategy. You're not having any raw food. Everything is cooked. Everything is soft. It's more mechanical soft. So it's a tough situation. But if you don't have gastroparesis, this medication could help you get on that. Let's eat less. This medication will help. You're going to lose weight. Losing weight lowers blood sugars. Eating less lowers blood sugars. So it just helps you to get to those behaviors that we want you to be able to do naturally.
Mm-hmm.
The incretin hormone is naturally activated when you're eating. So if you don't have diabetes or you don't have this issue, naturally, when we're eating, the incretin hormone is activated to tell our pancreas to send out the insulin cells to get rid of these blood sugars. So that's what it does. It activates it because sometimes in patients with type 2 diabetes, your incretin hormone isn't really activated. So you have the digestion, you have the blood sugars rising because the pancreas didn't get the message it's supposed to be more active. So it's again, these medications that have been developed over the last 10 years are really fascinating to learn about. So yeah, this could be another one that you could have that targets a whole different area of your body. So you could be on 4 medications by this point and still be targeting different areas of your body to get the same result, which is a lower blood sugar to save your kidneys, your eyes, your heart, your nerves. Blood sugar is not meant to be stored in the blood. It's meant to be stored in your cells.
And the symptoms that this medication helps to fight, they're not permanent, right? So once this function is restored, you can get off this medication, or this is already for you to keep.
Absolutely. If you follow, if you're changing your diet, you're stopping overeating, you're changing to eating more foods that naturally are digested very slowly. If you change your eating habits, yes, absolutely, you can get off this medication.
Mhm.
But it just makes you feel full longer, which is, what we want. We don't want to be hungry. And oftentimes, if you're not understanding how to eat, we're eating foods that primarily raise blood sugars and that don't make us full. So we're eating constantly foods that raise blood sugar. So this does help to get you some time, some space to really work on your nutrition plan.
And it's actually could also, just thought about it, could also help the strategy, because very often we eat with our eyes first. So we got to see the full plate. But when we already used to having smaller plate, we kind of it's becoming fine for our bodies, and we are not feeling that hungry even without medication, because we're already used to having plate, maybe smaller plate. No, it still will be the full plate, just the size from the dinner to the this uh, appetizer plate. So
Yeah, we have increased our portions of food, from if you look at a restaurant meal in the 60s and 70s,
mhm.
that was a normal portion. You look at restaurant meals now, that's about three portions of food in one meal. And so, we eat that at a restaurant, we eat that at home. We're not realizing these are not the portions that our body can really tolerate and handle. It's just learned over time. And it might take a little bit of help to get back into a normal portion
Mm,
size for food.
mhm, mhm,
The first injectables that came out for GLP-1 injectables was Victoza. And there's another one, oh gosh, I can't even remember the name of it. It's not even prescribed any longer because the new ones are so good. But Bydureon, Victoza, Trulicity is still used quite a bit, and Ozempic and Mounjaro, of course, is one of the new ones on the market. These are injectables that you just take once a week. Isn't that brilliant? You don't have to take this every single day like you would the pills. This is a once a week injection. So those patients who forget to take medications, can't remember, don't want to take them, once a week, you can remember that. This was so fascinating. Everybody wanted these new medications. Oh, I just take it once a week. This is great. It does the same thing as the pills, which your stomach is an escalator or a conveyor belt. It literally stops the food from being digested quickly. That makes you feel fuller sooner. You're eating less naturally. You're able to lose weight. You're able to reverse diabetes. And then we have to transition you to how to do that naturally. But it can help people who have been struggling with their weight for so long and struggling with high blood sugars for so long. This gives you some space. It gives you some time to get those, you know, behaviors in place before getting off this medication. Some people may not get off this medication ever, and that's okay. But I'll tell you about some drawbacks in just a little bit. But it does stimulate the pancreas also to release more insulin. So it can have a hypoglycemia effect, but it's not the primary concern here. Again, like Arena was saying earlier, if you have a condition called gastroparesis, that is a damage to the nerves in your stomach. Our whole body is just full of automatic functions. And if the nerves aren't working, the stomach doesn't work. This would not be a medication for you. You would you would feel terrible having that food stuck in your stomach and this medication that continues to do that. So your doctor should know that about your medical history. And I'm sure they would know this would not be the right medication for you. Although I have seen it. I have seen some of my patients with severe gastroparesis also be on this medication. And it's bizarre. I don't know. I educate my patients on what to questions to ask their doctor. And sometimes they end up getting off it. Yes, anything that affects the stomach is going to cause you diarrhea, bloating, nausea. You could vomit. I mean, you've got a small stomach. And if the food is stuck there, but you eat a large portion, like people who eat quickly, that could result, not much can fit in there. And if it can't fit, it's just going to come back up. So you learn very quickly the portions that you can tolerate.
Mhm.
One of the biggest disadvantages to this is because it's so effective with weight loss, our patients are losing weight very, very quickly. So let's say your body needs minimum 1,500 calories, to function all of the symptoms. But being on one of these medications, Mounjaro, Ozempic, Rybelsus is a pill still, but it works much better than the other medications. Um, if you're not getting in enough calories, your body, yes, uses body fat. Your body can take body fat and use that for energy. But you know what else it uses? Your muscle. Your muscles can also deteriorate. So we're going to have a huge population of our patients where they're trying to get off this medication. And you know what's going to happen? They're going to gain the weight back very quickly because your muscles is your metabolic effect. When your muscles have diminished or they've been wasted because your body wasn't getting in enough calories and you lost a lot of weight, your muscles went with it. Our muscles are a metabolism booster, so we don't have that anymore. You could struggle with a quick weight gain after getting off these medications. Knowing that, if you are on any of these medications, I don't care your age, you must get in some type of program where you're working muscles, swimming, walking, core training without weights or using weights to build muscle. It is so important that you know this about this medication. Everybody going on this medication, this is what they need to learn immediately, but the doctors aren't saying this. So I'm saying it now, but it's sad that we don't get a lot of information when you go on these medications. It's very popular. Everybody wants to be on them. Oh, I'm going to lose weight. But that's the dirty little secret. You're also going to lose some of your muscle mass if you're not actively maintaining that. It's a high protein diet. It's a weight training strategy. Even with those exercise bands can also build your muscle back or prevent your muscle from wasting. But protein and exercise are very important if you're taking any of these medications.
And unless you are planning on being on this medication for the rest of your life, then you eat normal, not normal. You don't have to gain those muscles because this medication. But without muscles, with the loss of the muscles, we don't have much to live on and move on. So it's important one way or another.
Muscles love sugar. So if you lose the weight of your muscles or your muscles waste and they're not as big and not as strong, you lose the ability to suck in extra blood sugar. So it really is an important part of knowing about this medication is brilliant. Many patients who have never been able to lose weight are finally losing weight. They're reversing their diabetes. They're becoming active again. They're eating better. They have a new lease on life. So I do like this medication for some of my patients, but getting off of it may not be an option. And if you do, you have to realize that you got to get in the gym and exercise. We should be doing that anyway. That is how our body needs to work. We need to move. We need to function. Sitting in a chair and just raising your arms up and down. We can just start there. Just start very, very simply. But that's a muscle. We're going to be working it. We're activating it. We're not going to lose that muscle if we work it. This medication, look at the percent, how it lowers your A1C much more compared to the metformin or the glipizide or the Jardiance. It's going to lower your A1C much dramatically. And weight loss up to 13%, that's unheard of. That is amazing, and probably more than that. So Mounjaro seems to be the winner here on the studies that show most people lose more weight on that medication. And there could be one reason or another you're on Ozempic versus Trulicity versus Mounjaro. And a lot of times it has to do with insurance, which, makes me so sad. Makes me mad. Any questions on this type of medication?
Well, I'm not waiting for you to to ask this. I'm asking right away. So I think we got I got clear on that. Let's see if any of our listeners have any questions, but I don't see any, so we could move on.
So again, that's the stomach. It works on the stomach, but it also does something very different. Um, Glucagon is a hormone that raises blood sugar. So if I have somebody who's insulin dependent, maybe a type 1 patient, they're insulin dependent, and if they have a low blood sugar, sometimes they take an injection to make sure that that blood sugar is coming into the blood very quickly. Well, this medication can actually suppress that. So, if that's something that could be an added feature, it also can cause a low blood sugar. So everything, you have to know what your blood sugars are. You have to know that you can't stop eating. You have to eat something every 4 to 5 hours through the day to prevent low blood sugars. But
So,
it's very effective at its job.
all right, which means that this medication and say intermittent fasting are not a recommended strategy.
Right. Yeah, because you're going to be eating less. Every time you eat, you're going to be eating less. So going 14, 16 hours without eating, I don't recommend that.
Well,
Not at all.
some people do 23 hours
Ugh.
without eating and then just 1 hour to eat.
I don't know how that's possible. I don't think I could do that. I mean, 10, 11 hours is, I mean, the time that you're sleeping, a couple hours before bed, I stop eating. And then maybe I don't eat for the first hour of waking. So, 9, 10 hours, you don't want to go. I don't think anybody should fast past that. Maybe they do. Maybe that's okay. If you're not on this medication, maybe that's okay.
Yeah, yeah. And this is for those who wants to try to uh, bring things to normal without medication. But if you're on medication, you have to pay attention to these important pieces that your muscles will get start deteriorate, well, destroyed if you don't provide extra food for the medication.
So if you've ever been in a cast or something where you're not using, your arm or your
Mhm.
leg, your muscles become very small because you're
Yes.
not able to work that. You're not able to exercise that. So this, in a way, your muscles are full of energy. Your muscles can be changed into blood sugar to fuel the body. Your
Mhm.
body fat can be changed into blood sugar to fuel the body. So your body's going to use everything it can to survive. And when you're eating 600, 800 calories a day, and you're, a 5'8" woman, 180 pounds, your muscles are going to be impacted. So if you start this medication, you start an exercise plan, you start swimming, you start walking. Don't just sit. You have to do something active if you're on any of these medications.
Mhm.
Finally, there's insulin. It's one of my favorite medications because it does what it's supposed to do. We have insulin in our pancreas, but as I said before, we are born with all of our insulin cells. Over time, our insulin cells lose their integrity. They stop working. They become inactive. So if you get to that point or you have the autoimmune condition, which is type 1 diabetes, where your body literally destroys all of your insulin cells, the only way, well, there's two ways, but the main way to get sugar out of your blood and to your cells that need it is with insulin, your natural insulin or insulin that you must inject, the exogenous insulin. It is not a bad word. It is not a bad medication. It's very effective. It works right away. Right away, it works to lower your blood sugars. Many people are resistant. You might think, oh, I start taking insulin, I'm going to be on it for the rest of my life. Sometimes, yes. If your insulin cells are no longer working, they're destroyed for whatever reason, yes, you will need insulin for the rest of your life. But it's an easy medication. We have other ways to inject insulin. We have insulin pumps. We have insulin pens. We have ways that we can make this a much easier process for you. And this was what my dad feared. He did not want to take insulin, but it's what kept him healthy for the last 15 years of his life. he needed insulin, and I was so happy to be there for him. I prepared it for him. He wanted to do his own injections. That was fine. But I was so happy to be able to make this a little bit easier on my dad. But it worked well. It kept his blood sugars down. It kept him free of complications for a very long time, until it was just, his time. So it's not something to fear. It's another helper. Oh yeah, Tanika, we'll talk about berberine. Um, yeah, so insulin, I mean, if you don't have the insulin cells, I mean, this is a medication that you will become dependent on, Tanika. Yes, insulin, it's there. It's there to do it. Now, but before insulin, we had patients with extremely high blood sugars. They couldn't get the sugar out of the blood into the cells. And so literally those people starved to death. Sugar is energy for your body. We got to get it out of the blood and to the cells that need it. So if we don't have that mechanism, then your body doesn't get fed and you slowly starve to death. So sometimes, yes, you are dependent on insulin because your insulin cells are just no longer working for whatever reason. Berberine, if we go back to metformin, berberine is almost a similar action as metformin. It targets the liver from leaking out too much sugar during the day, but it doesn't work as strongly as a metformin will. So I'll have patients all the time say, well, I'm not going to take metformin. I'll just take berberine. You can certainly try it. Maybe put on one of those continuous glucose monitors so you can see your blood sugars all the time. And if the berberine is not working, you probably need to switch back over to metformin. It's a very excellent question. So insulin is the key. Arena doesn't like this image, but it's the best
No,
image
no,
for
no, I'm
me.
fine. I'm fine. I
So,
have seen a lot of presentations when
yeah,
this is performed, and people, I think people recognize that image now. It's becoming almost like
yeah.
icon. So that's okay. That's good.
So I just think it's a brilliant way to think about it. So if you're like, here's these cars, they're kind of stuck in traffic. Not that a key is going to help them, but they need an opening. They need somehow to get out of there, out of that traffic jam. They need somehow. So when your blood sugars are stacking up in your blood, that is not where it's supposed to be. Insulin will open the door to the blood vessel to let that sugar out, and we want to put it into the cells that need it. Our hair, our eyes, our muscles, our skin, our organs, every thousands and thousands of cells in our body run on blood sugar. So we have to find a way to get it out of the blood into the cells. So if you don't have the insulin cells that you need to control the blood sugars, then yes, insulin is something that you could become dependent on. Or I wouldn't say it in a negative way. I would say, thank goodness we have insulin to keep the blood sugars lower when nothing else works. So there's different types of insulin. There's so much information here. I just really wanted to summarize it for everybody. We have insulin that works 12 hours. We have insulin that works 24 hours. And then we have insulin that works very, very quickly. And you probably would be on the most common combination would be the 24-hour insulin and the rapid insulin if you need it. Not everybody needs that. I serve a large population of pregnant women with gestational diabetes and type 2 diabetes. And often the 12-hour insulin works best for them because we're only seeing higher blood sugars overnight. That impacts baby. So the 12-hour insulin is sometimes all you need. It's also more affordable at the pharmacy. So sometimes my type 2 patients, and this was my dad was on a mixed insulin that only worked 12 hours. So he took one dose at night at dinner and the next dose in the morning at breakfast. So it covered 24 hours. But because he's a big stickler on cost and he wasn't going to pay more than, $5 for medications, this was the medications that worked for him the best. So the difference is in a 12-hour insulin versus a basal insulin is the 12-hour insulin gradually increases in strength. So at the first to fifth hour, so 1 to 5 hours, the blood, it's gradually increasing in strength. By the sixth hour, it's at its strongest amount. And then from there, it decreases in strength again. So it really just targets the meal or the area that you need the most blood sugar control. Some of my patients are taking this at lunch because their dinner is their higher blood sugars. And so by the time they eat dinner, it's going to be working more strongly to keep those blood sugars down. So we can move this medication around to different times of the day to get the best impact. I like this medication. Again, it's affordable. Walmart is one of the only places you can get it in its generic form. Walmart makes this under their brand of Rely On, and it could be 50% less than what you could get at the pharmacy. So affordability, this medication is often used for those reasons. Humulin, Novolin are common names for this medication. If you take this medication, yes, and don't eat, skip a meal, absolutely, it can cause a low blood sugar. Absolutely. So if you want it to work for your lunch meal, you take it at breakfast and you're going to have a big lunch meal, but you miss lunch and it's at its strongest amount at that 6th hour, then you could have a low blood sugar. So you can't skip meals when you're taking this type of insulin.
So it's not the insulin that you give a shot in the evening before you go to bed.
It can be if you're one of my pregnant patients, or it can be if many of my patients with type 2 diabetes have higher blood sugars overnight because of the liver. Maybe
Mm-hmm.
they can't take medication, the metformin medication. So sometimes they are on this at night.
Mm-hmm.
But it gradually increases in strength, and then by the 12th hour, it's basically out of your system.
Mm-hmm.
The basal insulin, these are the most popular. Lantus, which is also glargine, that's now generic. We can get it much less expensive. Tresiba, Toujeo, those are popular basal insulins. It's basically a flat line of insulin for 24 hours. So it doesn't have a peak. It doesn't have a peak and it doesn't have a decreased amount. So you take one injection a day and it's the same for 24 hours. So basically, when you're not eating, it should not cause a low blood sugar. If you're just on Lantus or Toujeo or Tresiba and you're having low blood sugars, then you're on too much of this medication. How we dose this medication and how you want to talk to your doctor or ask your loved one who has diabetes if they're on any of these basal insulins is, how is your fasting blood sugar? That's how this dose should be adjusted based on what are you waking up with. If you're waking up at 80 to 90 or 80 to 120, the amount of basal insulin you're on is perfect. But here's what I see so often, and this is what I need you to know. If your loved one is on 10 units of Lantus and they're waking up with blood sugars in the 200s, they need a lot more of that Lantus insulin. We call it the medication that will fix the fastings first. We want to fix that fasting blood sugar by increasing that basal insulin over time, 2 to 4 units a week until we get that A1, that fasting level that's under 150, under 120. We just want it much lower. So if you're on a basal insulin and your fastings are high, you can talk to your doctor about increasing that dose. I tell my patients all the time, until your fasting is under 150, go up 2 to 4 units of this every single week. It may take 10 weeks to get you down under 150, but at least you're working on it. You're doing what you can. Now, I don't want you to go 20 units higher. Let's just see, what 2 units will do, what 4 units will do. So it's a slow rise, but if you're on 10 units in January and I see you in 6 months and you're still on 10 units and your fasting is over 250, you were not given the right information. So yeah, you want to involve your doctor. Say, hey, doc, I heard something from the dietitian that says I could probably go up on this Lantus if my fastings are still high. Yes, you can. Tell your doctor that you would like to be able to increase it every week, and they can help you come up with a plan. Or come over to see me or go find a registered dietitian that specializes in diabetes. We can also educate you on that. The doctor has 10 minutes, 15 minutes with you. I have an hour. So you're going to hear more information from me about the medications you're on compared to that first visit with your doctor.
And all you are talking about, it also involves the not only relying on medication, but also making some changes, right? So um, it, changes in your diet, maybe changes in the way how you sleep or how much you sleep, changing in the way how much you do some physical activities, right? Because if you um, do everything, change the diet, uh, made some changes in your schedule so you sleep longer, included some physical activities, and increase the insulin, your blood sugar may go down very fast, right? No?
So the basal insulin, if you're just on this Lantus, Tresiba, Toujeo, if you're not eating, I mean, you should eat your 3 meals a day, but between the meals, it should not cause you to have a low blood sugar. But if you're skipping meals and you're on a basal insulin, Tresiba, Toujeo, Lantus, Glargine, yeah, you could have a low blood sugar. It is something that you can't suck out of your body. Once you take that 15, 20, 30 units or 100 units of Lantus, it is in your system for 24 hours and you can't stop eating. So sometimes if you're sick, the doctor will ask you to take half your dose or stop it if you're not eating anything at all. So
Mhm,
you have to stay in touch with your doctor, with your care team to get those instructions.
mhm,
Rapid insulin is something that you would take quickly, right before the meal. It works within 20 to 30 minutes. It starts lowering your blood sugar. So my patients who really their insulin is not working at all, or they have type 1 diabetes and they have no insulin cells, when you eat a meal, you want that insulin ready to get those sugars down because you don't have to stop eating carbohydrates. You can still eat bread, you can still eat pasta. We'll talk about a meal plan for that. But even if you don't want to change your diet, you still want to eat the way you have been, at least you can take this insulin before you eat to keep the blood sugars lower after eating. The whole point of all of these medications, the bottom line is, how can we control the blood sugars to prevent complications? Higher blood sugars over time create major complications in your eyes, your heart, your kidney, things that you need for the rest of your life. And once they're damaged, they're damaged. It's very hard to recover. You can stop the damage, but you may not be able to make it as it was. It's not going to be like new. So you may have eye issues, you may have kidney issues, and you may have to follow a different diet because of the kidney issues. You may have heart issues, you may have nerves, like your nerves in your feet are not working as well, and it's very painful. So we want to prevent all of that. It's preventable. Yes, sometimes you need to be dependent on insulin, especially if your body is not making insulin anymore, as in my patients with type 1. But many of my type 2 patients, you have insulin, it just doesn't work for whatever reason. It's just not able to get the job done. So that's what the rapid insulin is for. This is where I see my most severe low blood sugars. And here's what you need to know. Insulin, the rapid insulin, is for the carbohydrates you're going to eat. Some of my patients have a rule, they take 10 units of insulin every time they eat. I'll have a patient that says, wow, last week I had a really low blood sugar. I had to call the ambulance, or my husband called the ambulance because I was passed out. Well, I asked him, well, what was that? What did you do? Do you remember what you were eating? Maybe they just ate a salad. That's not a carb, but they took 10 units of insulin. That salad is not going to produce blood sugars. You don't need insulin if you're not going to eat food that raise your blood sugars. So oftentimes that is lost in translation. Okay, I take 10 units with every meal. Great. But if you're just having a steak and some broccoli, that's really not a meal that's going to cause a high blood sugar. So that's why the benefit of coming to a registered dietitian, because we have more time with you and we can explain all of these things, is really going to prevent those low blood sugars, because that can be very scary and very severe to the point where you could pass out and you could be driving and you could have children in the car. And this is my fear, my patients taking insulin, rapid insulin. So I say, everybody, if you get your CGM, put it on that arm. You're not going to drive unless your blood sugar is over 100. You have to be very strict about that, because if you take too much insulin and you didn't eat enough food, then you could have a severe low blood sugar, and that is detrimental.
very important.
Very, very, very important. So we have Novolog, we have Humalog, we have Apidra. You take it 15 minutes before eating. It's a rapid onset of 15 to 20 minutes. Here's a famous story. This was, I forget his name, but here's a famous story. So this was an athlete, an Olympian who had type 1 diabetes. And he went to the movie with his children. This is a famous story. You can probably Google search it. And so he took his insulin in his car because he knew he was going to get popcorn. And the insulin is because he's going to eat popcorn with his kids at the movie theater. And so he was preparing his body to accept those carbohydrates so his blood sugar doesn't get too high. Been type 1 most of his life, an athlete, very friendly guy, knows a lot of people in his community. So he was going into the movie theater and his friends and people, oh, hey, how are you doing? We're taking up his time. He knew he's got 15 minutes. He better get that popcorn in 15 minutes. Well, what happens when your blood sugars start to become much lower? So he had the insulin and he hasn't eaten yet. Your brain stops working. Your brain can't get through the thought. He knows he needs to get food and he knows he needs to tell this person, hey, I gotta go. He just can't get the words out. He knows what he needs to do, but the brain is no longer functioning. So what happens when your brain no longer functions and now his blood sugar is dropping, because now he's been delayed 15, 20 minutes. And you can also become very combative and you can be very, kind of weak, bumping into walls. And so the security guard at the movie theater was like, oh, that guy's drunk. Because that's how you look when you have a low blood sugar. You're slurring, you're drooling, you become very mean and just get away from me and stumbling. And maybe the people didn't know who he was talking to that he had type 1 diabetes and he needed to eat right away. So all of this happened within 15, 20 minutes, and he had a low blood sugar. But he had a wristband, but somehow it became loose when he was struggling with the security guard because now he's fighting the security guard, saying, I just got to get some food. And but the security guard kicked him out. He ended up going to jail. He almost died because he had a coma from a severe low blood sugar. So it is serious. You don't take insulin with just, oh, I'll just take 10 units here and there. You have to have a reason why you're taking it. Are you eating a meal? Do you have carbs in the meal? Yes, you can take the insulin. You know, maybe eventually you want to get off the insulin. Yes, we can help you change your diet. But Irina, sometimes my patients don't want to change. They're like, I don't want to change what I'm eating. I don't want to change what I'm drinking, but they will take the insulin to save their life, which is amazing. But insulin very, very quickly can cause you to become a whole different person when you don't know what you're doing. So you have to be very careful. It can be dangerous in the wrong hands. So for your loved one, you need to know what are the signs and symptoms of a low blood sugar, and that's what it is. You become slurred speech, you're not talking in sentences, you're not making any sense. You can become very combative. Even though you're a super nice person, you can just be cussing and get away from me. Those are all signs of a low blood sugar. So knowing how to check your loved one's blood sugar, knowing how to read the CGM if that's what they have on their arm, knowing how to get access to that information. A blood sugar under 70 is low. A blood sugar under 50 is critical. I've had patients in my office with a blood sugar of 20 and 30. So sometimes I didn't even see the signs, but they were there. If I would have stopped talking for a second, I would have noticed it. So we had all the tools that we needed in the office, but if you're home, you have to make sure that you have those tools of the quick acting sugars, the juices, the sodas, the glucose tabs, and glucagon is a pen that most of my type 1 patients do have in their purse and in their person, when they're out and about, because a glucagon injection can increase blood sugar into the system to save their lives. So it's nothing that you want to mess around with, but if you need it, take it, but have a reason you're taking it.
Mhm.
Did I miss anything?
No, I think you are good. I'm just nervous that we have only 30 minutes left and you have,
I'm done.
oh, all right.
Free medications. Do you know what these are?
What? The food?
Exercise.
Okay.
This is how I see it in my head. Here's your muscle. Your muscles want your sugar. Your muscles don't need insulin to get sugar from the blood vessel to your muscles, but you have to activate your muscles. That's the only way the muscles are going to get the blood sugar. Your muscles have a direct line to your blood vessel where all the sugar is being poured into, and it wants your sugar. We do not need insulin for this to happen. So, but you have to activate your muscles. You have to walk. You have to stay active. You have to keep moving around in the day, not sitting after eating, moving your muscles, your legs, your walking is the best exercise to lower blood sugars. If you can't walk, then you can sit in a chair and do some arm exercises. But this is free medication. This works all the time. So if you don't want to be on medications, here you go. This is the secret. This is how you avoid medications. You become active. You're probably going to lose weight. You might be eating differently because now you got this new body and you don't want to eat the way you were eating. So it leads to a lot of great discoveries about what you can do to control your blood sugar. It's free. Yes, I got to talk about food. If it looks like it does in nature on your plate, that's the best food. I don't care if it's an apple, an orange, cabbage, sweet potatoes, baked potatoes, but the more natural food that you can eat, the better it's going to be digested. It's going to digest slower and it's going to fill your body with vitamins and minerals. I'm in the grocery store all the time feeling so sad because everywhere I turn, it's a sale on chips. Buy one, get one free, candy bars, juices and sodas. It's like, oh my gosh, it makes me so dizzy and anxious when I go in the grocery store because I know how to choose foods, but I even go into the chip aisle going, oh man, those look so good. But you have to be able to say no. You have to be able to laser focus on what is best for you and your health. Saving your life is worth it. Saving your life is worth all the changes that you're going to make in your diet. You can do this. This is the only chronic disease that you actually have control over. You can save your life. Carbohydrates are not the devil. They're not toxic. They're not going to kill you. They're not poison. They are foods that give you energy. Yep, they raise your blood sugars. So be active after eating. Take the medications that you need to take. Maybe you do need to take insulin with your meals. That's okay. It's all a part of living a healthy life. And sometimes you do need medications to make that possible. The plate method is the main design that we use to control blood sugars with eating. And the plate design shows us this. The more vegetables that are not starchy we can add to the meal, like broccoli, and the more protein we can add to the meal to save our muscles and also to make us full. Protein and non-starchy vegetables don't raise the blood sugar. So they're amazing foods to pair with your favorite carb. Maybe it's rice, maybe it's pasta, maybe it's bread, maybe it's a dessert. But use those helper foods so you can have a full meal without having a huge blood sugar at the end of it. So save a small portion of your plate for the carbs, but everywhere else on your plate is going to be protein, veggies, and high fiber foods that don't impact the blood sugars as quickly. I have another presentation on that Irina and I did several weeks ago that I think it's stored in your website
Yes.
and the Facebook page.
Yes, we have this for replay, so reach out. We will be sharing it too.
Order eating. This works. I have tried it. I have tested this new CGM called Estelo. You don't need a prescription for the Stelo. Maybe I'll do another presentation on that, me wearing that in my readings. But Estelo is made by Dexcom, which is a very popular continuous glucose monitor sensor. I loved it. Some people can't use it, especially if you're on insulin. I don't recommend it, but if you're pre-diabetic and you just want to see how your blood sugars are, this was fascinating. So I did my own advice. I had the meal, I had the vegetables first, the proteins first, the healthy fats, and then I saved the carbs for last, and I intentionally took a 30-minute walk after eating. I did that, and then I also did I ate the carbs first. I didn't exercise after eating. I maybe didn't add enough protein or veggies. And my blood sugars were so different. You could see the dramatic rise of the blood sugars when I didn't eat the protein first. You can see a much lower effect on my blood sugars when I did eat the protein and vegetables first. So it's fascinating. You can actually change your blood sugars based on what you eat first in the meal. Isn't that great? You have so much control here.
Absolutely.
So you
Yes.
can find me on Facebook. I do answer as many questions as I can in Arena's group. I do have an Instagram page. Basically, searching my name will pretty much get you to all my locations.
And in our Facebook group, Diabetes 101 for Beginners, Kim is listed as an expert. So if you go to list of experts in the group, you could find there too. Kim, there is a question from Tanika, would there be another supplement you would recommend along with berberine to help if someone does not want to take these prescriptions?
That is a really great question, Tanika. I'm so glad you asked that because I think we're always looking for maybe the supplement will work. Well, I'm telling you, the supplements will not work as quickly as the pharmaceutical. So if you have high blood sugars, take the prescribed medication from the doctor. Don't rely on the supplements to help you. Listen, if the supplements were just as strong as the medication, the doctor would be prescribing the supplements. They don't work as fast, they don't work as well. The supplement industry is, we don't know if you're actually getting berberine in your supplement, if it's not third party tested. And there's so much fraud in the supplement industry. So you want a medication, you want to lower the blood sugars, take the darn medication that the doctor prescribed. That's going to be the safest and the fastest way to get your blood sugars improved.
So
Exercise, exercise.
basically, supplements are better when you have everything under control and to prevent from, breaking into the diabetic zone, you could take as a like prevention measure. But when once your blood sugar is already out of control, it's better use the medication, bring it back to normal, and then um, use the CGM and see what works for you because everybody is different. And for some people, berberine is working. For some people, it doesn't work at all. Some people use it as a replacement for metformin. Some people use it with the metformin. And as I said, I see a lot of people in our Facebook group saying that it didn't make a change for them, so they do not use it. So it's all very individualized and you got to learn it. But if the blood sugar is high, right now the critical question is to bring it down. Once it's down, then you could try experiment and learn what works for you.
That's right. That's exactly right. Getting the blood sugars improved faster. We have the research. We know that the metformin works. We know the Farxiga works. We know the GLP-1s work. We know all of that works. And so that's what I would start with. Get your blood sugars improved, change your diet, change your exercise. It's work. You have to do the work. You can't just sit there and expect, the berberine to work. You have to still do the exercise, do the meal planning, stop the sodas, get diet drinks, zero sugar. If you're drinking carbohydrates, I never recommend drinking carbohydrates. Eat the carbohydrates, drink zero sugar drinks. That's the quickest way to cure a high blood sugar often.
Yep. Definitely. Any other questions? Because we have a couple more points to cover here.
I think you were going to talk about more of the emotional side of things,
Yes,
Irina. Yeah.
this is something that I also wanted to cover because this is, in my opinion, very important to keep it, keep in mind, right? So when we are, how about that here? When someone is diagnosed with type 2 diabetes, and it could be yourself or could be the one who you
Can you
take
go to
care of.
presentation mode, make it a little bit bigger?
I'm not? I thought I am. Oh, hold on. I think I am in presentation mode. You are muted.
Yeah, I can see your sidebar.
You can see my sidebar?
Yeah, that's
Okay.
okay. I mean, I can still see it. It's just very small.
All right. I'm supposed to. Okay, hold on. Hide presenter overview. So now you see it better.
So now I don't see it at all. So go back to where you were. That's fine.
Somehow I closed the window. Okay, here we go. You could see it
Okay,
now,
Cece
right?
could see it. Yeah, that's fine.
All right.
Perfect.
So,
Yeah.
anyways, and the emotions that people experience when they diagnose, they are real. They are real. This fear, the grief, the frustration, it's all important to remember. And the ability to control the stress is contributing to the blood sugar levels as well. because we are all uh, in the past lived in the wild and used to this point that if there is a stress present, if there is a scare, something like this is happening, your body mobilizes all its resources to protect you from the damage. So all the sugar is staying in your blood, providing the energy. And your stomach is not working that well consuming the food because everything is to save you from that tiger that may be chasing you or whatever danger is out there for you. So keeping emotions under control is very important, but because the uh, this process is broken for people with diabetes, we got to, as caregivers, we got to keep this in mind as well. We need to find ways to communicate in such a way that doesn't create extra stress that is already present, and that we can help without irritating. This is something that I did not do too well because I didn't know how it works. And as much as I was trying to help, I served more as a police officer rather than the helping, understanding person, which is I have to carry with me, and I hope that you don't need to experience it, right? So I wanted to offer to everybody who is in our caregivers community, for those who just entering the group as a caregiver, please be informed that we are here to help you to recognize those signs, because this is important for everybody, including you, caregivers, people who are not taking care. Caregivers are giving care, but they don't take a good care of themselves. So we are here to help you, to provide you information that sometimes doctors are giving to patients, but they don't see the caregivers. So Kim, myself, we also have Daniela, who is also the member of our team. We can help. We are offering you help. Don't hesitate to ask about it. And you can help by taking some activities on yourself. You could see for different programs that are available in your area. You could learn some nutritional information that sometimes people who are diagnosed, they refuse to receive the information because they are depressed, because they are afraid, because they are stressed out, and the information that will help them is not going through. Not because they're hard-headed, it just sometimes emotional block that they cannot pass. And as a caregivers, we should keep it in mind and help in the most effective ways we can. Um, we can help you with the grocery shopping, and if it's needed, Kim and myself, we could create an activity of grocery shopping. Kim has plenty of examples of what is available in stores and how to look at it. We could do the label reading exercise, right? We could talk about meal prepping. This is important part because when you don't have to stress out before every meal because you already did this work and you're confident in your actions, you are relaxed, you spread more calm around you, and the person you're caring for actually is not feeling anxious either, or maybe not feeling as anxious. Um, you can be the assistant in physical activity. You don't have to be a policeman. You need to take care of your own body. You want to be able to provide help and support. For that, that body needs the care. And walking is great for people with diabetes, but walking just as great for people who don't have diabetes and wants to be able to walk and run and help at any minute. And for that, create some routine that involves, I'm going for a walk. I need it. Would you like to join me? It will be great if you can join me because we have so much to talk about. Oh, I wanted to show you something that we always passing by and I didn't have chance to show it to you. This is something that we can do as caregivers without really saying walking is good for you. You got to do this. No, I'm going for a walk. Would you like to join me? This would be fun. And really, it is fun. It will be fun if you don't put a lot of, I don't know, pressure on it. Medical appointments, sometimes they're daunting. And making, yes, for someone with diagnosis, to make all those phone calls and go and wait and do all this, it's hard, and there are so many other things that they have to worry about or they don't want to worry about. You could take it on yourself and just say, look, your next doctor's visit on such and such day, just make sure that you don't plan anything on that part of the day. And this is something that maybe immediately will not be received as a huge help, but overall, when the results will show up, and they will, the results will show up when there is a team effort and everybody is participating and doing their part. At the end, you have something to celebrate. You have something to be happy as a team result, and and to be proud of. So like, look at Kim. She is sitting here being the proud person who helped her father to live, what you said, 30 years, 30 extra years. I think this is something that we all can do and can help. Not necessarily 30 years guaranteed. Some people get diagnosed much early in the life. Some people get diagnosed much later in the life. Whatever is on our, schedule of being present on this earth, that's what will happen. But we don't want to speed up this departure. So let's make it as long as it's possible, as enjoyable as possible for everyone. Because when somebody's blood sugar is very high, it's hard on people around them. My kids experienced firsthand when their very loving and caring and kind father experienced the high blood sugar episodes. It was not easy on kids either. I'm not even talking about myself. So let's participate. Let's be participants and enjoy the results. Is there anything else I have to say? Well, this is it. We have the Facebook group. It's a private group, Diabetes 101 for caregivers. And I invite everybody to actually talk to me and join us on this group, because this is something where we could talk um, and share experiences and discoveries. And I hope that, yeah, thank you. This is very helpful. My husband was just diagnosed last week and is very pig-headed. I feel rather helpless regarding how to help him without being annoying. I hear you. I know what how it could feel. So I hope that you will be able to help him without really going crazy yourself. And please take care of yourself. This is very important. Very important.
Yeah, Cece, it's really tough. I know that you love your husband and you want him to do everything you say and everything the doctor says, but we can't make people do something they don't want to do. And it is unfortunate. I do see that dynamic very much in my practice where, the husband or the wife just doesn't want to do anything. They don't want to change anything, and they end up developing complications. But I'm sure that whatever happens, that you'll still be there, but be the example. You change, you stop bringing soda into the house. You make the changes, you exercise, you get yourself in, where you want your husband to be. And sometimes they're like, oh, maybe I will do what she's doing, but be the example, be a gentle nudger, encourager, but you're not able to demand somebody to change. unfortunately.
Yes, and one thing that actually, when we have our expos, we have every 2 months we have diabetic healthcare expos, and people, we have a lot of different experts participating there, including social workers, including the people who are working like stress management experts, and they often will say, keep in mind that everybody is a human. And as human, we will do the mistakes. We will have our weak moments. The idea is to empower people in such a way that those weak moments doesn't happen on a regular basis. Uh, every once in a while, somebody will sleep off and may fall and may do something that is not doctors prescribe, but that's okay when it's every once in a while. When it's a system, when it's every day you do something that you know that you shouldn't be doing and saying, oh, tomorrow will be another day, and another day brings more of those mistakes, um, maybe we need to bring some other intervention here, and we could talk about it as well. So be patient, please. Learn as much as you can, educate yourself as much as you can, be prepared for different scenarios. Ask for help. Ask for help. We're here to help you. All right. Well, with Kim, you did great, and I so happy that you are really going to details that are very important, and thank you very much for that. Um,
You're welcome.
as I said, all the recordings from the previous presentations and this one will be in our group Diabetes 101 for Caregivers. CC, you are welcome to join us there. Um, if you don't know how to get there, reach out to me. I am in the Facebook group admin. You could send me private message. You could ask any of admins. We all know how to get there, how to get to me, because I'm the one who is a gatekeeper. I don't want people who bring damage to be there. So,
Right.
and that's pretty much it for today, unless there are more questions. The next session like this one will be next month in April. And because in April, on the last Saturday of the month, we will have our Diabetic Expo, this session will be on the 19th of April. So Kim, please mark your calendar.
I'm doing it right now.
19th of April, it will be the Diabetes 101 for Caregivers. On the 26th of April, it will be Diabetic Healthcare Expo. These are two events that I guarantee, but we will have more events coming up. I have meetings with amazing people almost every day, and we are really looking forward to bring help, support, and different ways to help you, to help everyone to fight that fight with diabetes, because it has to be stopped.
Thank you again for this opportunity. It helps me to fine-tune my presentation skills, and I really enjoyed going over the medications and learning some things that I had forgotten.
All right, thank you, Kim.